Hey everyone, it's Troy Jackson with the Weekly Update. I want to start out by just explaining on Friday of last week, the Trump administration actually came out with a rule about drug importation to the United States. This is something that we've been obviously tracking for a long time. Last session we passed a bill to allow importation. I live right on the St. John River, the bank of the St. John River. And the St. John River, for a big part of my district, is the boundary between Maine and New Brunswick. And it really is, striking. Many places along that river, in the summertime, you could walk across it. If you had a good arm, you could throw a rock across it. But there's such a divide there, such a gulf between the people on one side of that river and people on the other side of the river. And I constantly am struck by the fact that when you stand there in the bank and look over into places like Clare and St. Leonard, the people on that side of that river don't have the problems that we have in terms of prescription drugs or even health care coverage. And it's really hard to understand how it can be just something as simple as the St. John River that makes that divide between the people that have good health care, have cheap prescription drugs, and the people that are on the other side of the river that don't. But we had to wait until the federal government allowed it, approved it. So the rule that the Trump administration put forward is definitely a step in the right direction, and I appreciate that. But it still gives way too much deference to Big Pharma and the drug companies, which is exactly the problem that we have in this country right now. The greed of Big Pharma has completely, basically, for lack of a better word, screwed the public. And this is something that, for me is a huge deal. I mean, the way it is now, Medicaid can't negotiate with pharmaceutical companies to get a better deal for their massive buying power that they have in this country. Congress expressly forbids that. We need to change that. We need to make sure that these pharmaceutical companies are held accountable. And just this week, Congress held hearings once again, trying to bring to light what a scam this actually is.
What I'm trying to understand from you is, how did the drug improve? If I were to look at a pill and analyze it from 2005, when it cost $215, and I was looked today at when it cost $763, would that pill be the same?
I understand your question about the pill. The manufacturing for it would be the same.
Great, thank you. So to put that in perspective, you hiked the price by $500 when the average Orange County senior only has $528 left in their bank account after they've paid their basic monthly expenses. The average Orange County senior can't even afford one pill. I want to turn to one other number, if you would help me. Do you know what this number is? Does it ring any bells?
But I think you're referring to my compensation in some way.
Yeah, well, in some way. This was your compensation in 2017 for being CEO of Celgene, and that's a lot of money. It's 200 times the average American's income and 360 times what the average senior gets on Social Security. In fact, you personally received $500,000 personally just by tripling the price of Revlimid. So to recap here, the drug didn't get any better, the cancer patients didn't get any better, you just got better at making money. You just refined your skills at price gouging. And to be clear, the taxpayers spent $3.3 billion on Revlimid, Medicare, $3.3 billion.
One day, there will be enough people in Congress that understand that the American public is really who elected them, and that's who we should be fighting for, not the pharmaceutical companies. And certainly in Maine, we're going to keep pushing that issue as long as I'm here. So at this point, we're just over a month before Election Day, and on the 2nd, the Secretary of State will be mailing out absentee ballots to all the municipalities. Everyone that has requested them at this point, and there has certainly been a large number of people that have requested, your absentee ballot will be getting mailed to your home now that they're being sent out by the Secretary of State. In addition to that, there's been a lot of people, well, I don't even want to say that. There's been some people that have argued that the absentee process is not secure. I disagree wholeheartedly, but one of the things I wanted to make sure is that people understand that the Secretary of State's office actually has a tracking program now, so you can see your absentee ballot through the entire process.
Voters must enter their name, date of birth, and city of residence to check on the progress of their ballot. They'll see a grid that will show whether their request was accepted or rejected by the clerk, as well as the date it was delivered to the voter.
Once you put it in the mail, where it is in the process of getting back to the municipality, the only thing that, because there is an awful lot of people that are absenteeing this year because of the pandemic, it's important that you get your absentee ballot in soon. You don't want it to get stuck in the mail. You don't want it to be late getting to the municipality. The other thing that the governor's office, along with the Secretary of State, has done is tried to help communities with drop boxes. There's a number of communities already that have these up, and so that would be another thing that I would certainly tell people to take advantage of. Obviously the voting process is a huge deal, making sure that your voice is heard regardless of who you vote for, and I think there's been a lot of thought and a lot of effort on how to make that as safe and easy for people this year as possible. So certainly be a part of the process. If you want an absentee, you definitely have every opportunity to, at minimum, take the opportunity to go on election day and show up and vote.